to all of you who are signing in right now. Give people a couple of minutes to get signed in. And we won't wait too long, Katie, because I mean, we're recording this and we'll share it out later. So for the folks that are here, should we just get going?
Yeah, let's do it.
Right. He says that and then forgets how to share his screen. And he shares the wrong slide. We're off to a good start, folks. Good afternoon and welcome, everyone. We are here to talk today about PowerHD. I am Arik Johnson. I'm the Interim CEO and Chief Mission Officer at HDSA. Happy to be joined by...
I'm Katie Jackson, Help for HD International President and CEO.
Katie, thank you so much for this. And really, truly, thank you for suggesting that we just sit down virtually and talk a little bit about what PowerHD is and why we think it's an important thing. So we are here today to talk about PowerHD, which is truly a community effort. Katie and myself, being from HDSA and Help for HD, are also joined by Betsy McFarland from HD Reach, who's not with us today, but we're three of the big HD groups in the community, and we're coming together to say this is an important thing for all of us to be involved in. It's the three of us who's signed some paperwork right now that's got our logos on this, but that doesn't mean there aren't other people having the conversation, right?
Right.
Yeah, so we're thrilled to be able to talk about this, why we think it is important for the people out there who are living with Huntington's disease. And this is why we're here. We know that people have questions. I know we hear them, Katie, I know you get them. And it's great. People should be asking questions about things like this. And we're thrilled to be able to start here by talking about some of them. I'll be totally honest. You might hear me talking about a lot of logistical things just because I've been in that piece of it a little bit more than Katie has. And Katie, you of course just interrupt me with anything too, but it's, I've got some of the nitty gritty pieces, but more important than that is the kind of the big questions, I think, that we've been hearing. Yeah. Like this, who is PowerHD for? Truly, anyone who's living with Huntington's disease. What do we mean by that? The person who is diagnosed with HD, the person who's at risk for HD, the person who's caring for someone with HD, the person who has JHD, the person who has lost a loved one to Huntington's. Everyone's input is valuable. Everyone's input is important. And this is a place for people to do that.
Yeah, and Arik, if I could break in here, I know a lot of people identify as multiple of these subgroups within our community. So this has been really hard. I know that's been a conversation internally with the PowerHD team, is that a lot of times you could be at risk and you could be a caregiver, or you could be living with HD, or you could be a caregiver, or you could be at risk and not considered a patient. So it's really hard, I know, to identify, and trust me, in the back end, that's being worked out because we are so different compared to other disease spaces that this was originally done for.
That's such a great point. And I think what's good and already available is you can identify as multiple things. You can say, I'm a caregiver because I care for my mom. You can say, I'm at risk. And you can get two different versions of questionnaires because those are two very distinct roles. That's a great point. I'm so glad you brought that up. And it is something that as people do this, you'll learn more about it. And oh God, Katie, I just blew into this. We didn't even say, for those of you who are here, awesome. For those who are watching this later, because we are recording this, you're going to be able to see it on Katie's the Help for HD TV station next week, did you say?
Next Friday, yeah.
Awesome. So you'll be able to see if it's too much for you to absorb right now, or you're going to share it with family and friends, check out the Help for HD TV station next Friday, and then we'll also put it up on the HDSA YouTube channel.
The only other thing, Arik, and then we could move on. I'm sorry to one more time. Another word that they use that's kind of interesting is they use a research partner. And we talked, Louise and I, and then Arik when he came in, and Betsy and all of us, and Jenna who was on the call. We also talked about like partner. Research partner is a word we're not usually used to using. A research partner, I always think of like industry or a sponsor of a clinical trial. In this case, your research partner is actually your caregiver or your care partner or your significant other that's walking this journey with you. In this specific space, they use this word research partner. That's a little bit something that we don't hear often.
Another great point, and I think that kind of speaks to some of the stuff we're going to talk about, like how the surveys are done and the kind of platform. Research partner is a technical term, but it really just means someone who knows you well, who might be able to answer some questions about your experience living with Huntington's disease, that you've invited to do that, right?
Yes.
Oh, awesome point. What is PowerHD? It's a federated data platform. What the heck does that mean? It's a place to go and answer surveys that are going to ask about the lived experience that people living with Huntington's disease, again, any of those different types of people that we mentioned, what is that lived experience like? And it's done by answering different surveys. And I'm putting something here that I put an asterisk there on purpose because we're going to get back to it later. What's really cool about it is these surveys are empirically validated. That is really helpful when it comes to research. We'll talk more about that in a bit. When can you do this? Katie, when can we do this?
As soon as possible. I think that we'll get into this a little bit later, but I think we are so often in the Huntington's disease community compared to other diseases. I was just on a call the other day and they were talking about caregiver burden, and they're like, how do we, clinically look at data of caregiver burden in HD? And they're like, well, you look at dementia, and that's not what you look at. We are not dementia. We are HD. And we need to be using our voices and talk about our lived experience and talk about what we're doing. So we are identified as HD caregivers. We are identified as an HD population. And this is one step we can do to start using our voices and tell our stories that comes from us, not from other disease communities. So I know there's a lot of surveys out there. I know there's a lot, but my thing is let's get it. Our participation is critical in all of this to move the mark and help this clinical development of drug development move faster. So now I like that looks good. That looks good to me.
I appreciate that. And I do realize, and to all y'all listening, I don't mean to make light of this. I do find I maybe say some things that could sound a little punchy, like now is the time, but really truly now is the time, because there are things that are happening, but there's still a lot of work that needs to be done. And the participating in something like PowerHD is truly going to be a useful tool to help speed that stuff up. I may be getting ahead of us a little bit. Now is the time to sign up. You can do it right now, but then when do you fill out the surveys? When it works best for you, right? This isn't like going to a research visit that you have to go to the clinic. And there might be people who are watching this who have never, ever gone to a clinic before, right? Like this is something you can do from home after the kids go to sleep. You can do this if you live in, California like Katie and I do. If you're not stuck in traffic because you're not working on your computer or your phone when you're in traffic. Sorry, that was a really bad example that I was about to share, but you can do this if you're like waiting in line at the bank, or you're in between meetings or something. You can fill out a 10-minute survey. Do it when it works for you.
That's right. And also, a lot of, like Arik said, a lot of people haven't been in clinical trials and haven't been into the clinic. And it's so isolating being at home, and you want to help and you want to do something. So many of us as caregivers sit at home and we I used to watch Golden Girls with my husband. For some reason, he loved Golden Girls. I don't know why. Um, I could have been filling this out then, right? And I spent a lot of time at home as a caregiver, and a lot of time wanting to do something. And this is another something that we can do, and make a difference, as being very isolated caregivers.
Oh, thank you for sharing that, because I think that is a really important piece, right? A lot of people want to do something, but don't necessarily have access to it. Can't leave their loved one, right? It's so true. And if there are times where you can do something, I love that your husband was watching the Golden Girls. Or like, I could be doing surveys instead of watching this show,
Yes.
which you should have just enjoyed the Golden Girls because it's classic. This is true. You can do it when it works for you.
Right.
Where can you do it? Anywhere that you're on a computer and have access to the internet. We've already kind of said this, and Katie, you made this point really well, which is from the comfort of your own home when you've got the time and space to do it. If you live in an area that you don't have Wi-Fi, or you don't have like, dial-up modem or whatever way we connect, or Ethernet or anything like that, if you go to a public library that has computers available, you can log in there. I know people are concerned about data safety, and that's something that we'll touch on. But the reality is, wherever you are able to connect, wherever you are able to sit at a computer or your iPad, and if you're that kind of person that does stuff on your phone, great. But being able to sit comfortably where you can sign on at a time that works for you. The why part. I mean, Katie, again, this is why you said why you suggested this, right? Like, why are we doing this?
It's so interesting, and I know that I don't want to go out on tangents, because I always say, like, when I speak publicly, I'm like Alice in Wonderland, and I go down rabbit holes, and I don't want to do that today. But I remember when I started advocating for HD. I'm going on 19 years. And we were talking about Dynabomb, and we were talking about fish oil and CoQ10 enzyme and creatine. And these are things mostly you could buy in the grocery store. And now we're talking about things like gene therapy, disease modifying therapies, CRISPR, slicing, all these different amazing new technologies that are coming, and people are looking at HD. And we need to be research ready. We need to be research ready. And I think we have so many great things to enroll, what that has given us over the years, and all these different natural history studies that we do have out there, but there are gaps and there are things missing. And so, we need to be research ready for when the FDA comes and they have something in front of them and they have questions about everything from caregiver burden to risk versus benefit. What are we willing to endure as a community? What are we willing to endure as a caregiver? What are we willing to endure as your body? We don't want them guessing. We want that verbiage to be ours. And how we can do that is we can participate in these kind of things. So we make sure our voice is heard, not from people guessing, but from us who know.
I love that. And it is so important that the people who are living with Huntington's disease are the ones who are saying, this is what matters.
Yeah.
This is what is important to me. And this is what we want to see happen. And surveys like this, while maybe not getting at those things exactly, are going to measure things like, am I experiencing benefits in this area, right? Like, whenever you go to a doctor's office and you say, I take these drugs, then you answer another questionnaire that says, how do I feel about my movements, my mood, or the way that I'm thinking, right? Is it better, worse, or about the same kind of things? That's overly simplistic, but by answering these questionnaires on an ongoing and regular basis, when you're living with something that is ongoing, like Huntington's disease, what we hope to see over time is getting this bigger picture that helps inform the people that are developing drugs, like Katie was talking about, and the agencies that are required to approve them so that they get to the people that need them, right? And so having the person with HD's voice heard, but also their data available, because whenever we're talking science, research, approvals, they all are basically like, show me the numbers, show me the data. And this takes the person's lived experience, their story, and captures it in a way that you can basically look at you're not really just looking at a spreadsheet, but you look at the results and you can compare it and you can look at it against other things and you can look at it as outcomes and things like that. So data is key, right? So this
Data.
is something that will help things move forward.
Yeah. And I think that with this technology advancing at such fast speeds, a lot of times there's so many surveys out there, and Arik and I know that, there's super important ones out there. We know Enroll has surveys. We know, HSG is doing surveys. We know
Mm-hmm.
HDYO has their series surveys. We just did a risk and benefit survey at Help for HD. We know HDSA is doing this very important survey for the PFDD. Like we know there's so many out there. We never know what regulatory agencies are going to ask, right? Because it's forever evolving, like the technology and like the research and like the drug development. Even their thought process is evolving. They're starting to talk about caregiver burden. We've never heard them talk about that before. So like I say, we have to be research ready. So no, a lot of these surveys you're taking may not make sense to you. Like, what is this going to mean in the future? Maybe nothing, but maybe it's going to be the key stuff that we need to push this research across the finish line.
It, love that point, because so often we find ourselves kind of scrambling to catch up to things. And this is a way to actually add to what's already been done. Katie's mentioned Enroll. We've talked about that, and I hope a lot of you know what that is. But I mean, that is a massive data set, and it's awesome and super useful. But Enroll is data that is collected. It's what we call clinician reported outcomes. So you see the doctor asks you questions, you answer the doctor assesses you, the doctor provides their information. The surveys that you will do when you join PowerHD are what we call PROs, or patient reported outcomes. There's no one between you and the survey. That answer is yours. This is what I'm experiencing. This is what I'm thinking. And we also know that sometimes people answer things differently when they're sitting at home on their couch than when they're in the doctor's office, right? So it's an opportunity for
100%.
people. Yeah.
100%.
Oh, I mean, who hasn't gone to the doctor's office and said, I'm fine, right?
Yeah.
Like we're there because we're not fine usually, but it gives people a chance to answer themselves without any, I don't want to say interference, that's the wrong word, but anything between them and what turns into the data. So it's the individual's perspective, which can actually eventually be compared to that kind of data that's collected from Enroll and other studies, so that you can have the clinician reported, the patient reported. And Katie brought up the research partner, which is someone who is seeing the patient. If they are part of it, that's a third piece of information, all kind of talking about the same thing. So you get this big picture perspective that we don't normally have. So the possibility here is super cool.
Yeah. And I love what you said about in the clinic too, because when I said 100%, I mean, when I would go into the clinic visits with my husband and we would see the doctor, like I felt like I had to go so fast, even like during our research studies and stuff. I felt like I was like missing stuff, and I would leave and I'd go, oh, shoot, I should have said that. Or I didn't think about that long enough. And so this gives you time, like, like we're saying, these times could be short that you're taking the survey, or you can really like think about your answer and say, wait, how do I really feel about that? Or how does my loved one, how do I think my loved one feels? And then let's, and let them take their time about how they feel. And you're not rushed, and you don't have people looking at you, which we often do as HD families, waiting for that answer. And it's kind of, like, I love the comfort of your own home.
Oh my God. And Katie, I like what you just said too, right? Like if you are someone who is, your partner has HD, or if you're a caregiver for someone with HD, and that person with HD is like, hey, I want to fill out these surveys by myself, let them. Don't
Oh
stare
yeah.
over their shoulder, because they might answer something different just when they're like, I get to think about this and I get to answer this and I get to give my very real answer here, which is
Absolutely.
cool.
Yeah, my husband was he knew exactly. And I would overpower him, and I would, as caregivers, we're very overpowering, and that's okay. I mean, we know we are, but And he would say stuff and I was like, that was so brilliant. Like he was so in tune with so many things I didn't give him credit for. And it really is his body, his journey. And he had the right to answer a lot of those things that I was trying to overstep him in. And I admittedly can say I did that. But man, when he would come up and have his own time and his own thought process, he gave me so much insight into himself. I wish I would have spent more time stopping and listening to him more. I think every caregiver does, because they are so in tuned with themselves in so many ways.
I appreciate you sharing, your experience and that message, because I think it is something that when you are caring for someone, when you are going to that appointment, you're trying to get everything done as efficiently as possible.
Yeah.
I want to make sure that everything is known. The beauty of participating in something like this is you don't have that pressure of time. You don't just have an hour appointment. I don't think I know we didn't mention this, but if you're doing a survey and you have to stop in the middle of it, it's going to save it. And so you can come back and finish it later. Some of them have like time limits on it, but you'll get notifications that are like, hey, you need to finish this survey by, a week from now or something like that.
Yeah.
But if you need to stop, it's okay. If you want to stop, that's always okay too, right? Like this is always voluntary. None of this is required. We want you all to do it. We want you to do all the surveys like Katie was saying, but we also recognize that you got to take care of you and yours. We want you to participate in this because we all want things to change. Going back to the how, sign up. This QR code that you've seen floating at the bottom of the screen, if you've got a smartphone or an iPad or a tablet and you can take a picture of it, you can link directly to the landing page where you can start signing up. You can sign up and create an account. You can start the consent process. We'll get into that in a little bit more, but it is as simple as that. If you don't have a smartphone handy, or you're kind of like, I don't like QR codes, we'll show you some other ways too. If you get to the landing page right now, please note that there's a lot of HDSA pictures on it, and that's going to change because, like we said, this is a whole community event. Working with Katie, working with Betsy, the other groups that we're talking to, we're going to show that this is people from all of our different organizations, but then people that we don't even know yet who are going to participate in this. So just don't want you to be surprised if you open it up and you're like, why is everyone wearing an HDSA shirt? It's like, we just have to update that.
It's my fault. I've been asked for pictures, and I was traveling in the last, last 3 weeks, and they literally have asked me for pictures, and I haven't sent them in. So that is 100% my fault.
Katie, no shame, no blame.
But yes, I have been asked.
It's what I think. What I'm going to say that Katie just said is this is a building process, right? We are growing this. We are making it bigger. We're coming together to say, let's all get involved in this. You're seeing me and Katie talking right now, but hopefully this is the last time you're going to see me and Katie talking about it. And then you're going to see other people talking about it. And we'll have opportunities to get more in depth on certain things of this. Today's really just the why we want you to do it and some of the basic stuff, okay? So hopefully you had time to scan that QR code. Let's go on to the next screen. Getting started is kind of as simple as 1, 2, 3. How's that? I feel like such a nerd when I say it, but it really is that simple, right? Scan the QR code or take a look at this website that's up there. That is the landing site for the HD specific platform or the HD specific page on the RareX platform. I'll tell you a little bit more about what RareX is in just a little bit, but right now, just know that that's how you get there. Once you're there, you just create an account. Here's my username. Here's my password. Here's some basic information that allows you to get set up that eventually goes away because all you're going to be is some data after this. Once you've set up an account, the second step is to do the consent process. This takes a little bit more time because there are a lot of things that you're going to be asked. Are you willing to do X? Are you willing to do Y? Are you willing to do Z? And some people are going to say, oh my God, that's just too much. But I think this is a super important part of the process because you get to choose what you share. You get to choose how what you share gets shared. Your data, you, the person who's entering these questionnaires, you have power over what your data does. Again, this is kind of like if you've ever gone into a study, and Katie, I know you all know this from, if you go in for a study, you go through this whole consent process. Like, here's the things to be aware of and to be thinking about. And it's super important to do because that way you know what you're getting into, but you can also refer back to it later on too, because some people are just like, yeah, I'll sign my name on the bottom and let's go. But we want you to be aware that you have that power. Um, Once you're done with that, start taking the surveys. And the beauty of this system is you will get email notifications saying, hey, there's a survey for you to complete. Or if you started one and you had to pause, you'll get a reminder saying, hey, there's a survey for you to finish. As the platform grows, and it's going to, there's a lot of stuff that's happening behind the scenes, you'll get more notifications. As you participate longer, you might get different surveys just because we know that HD changes over time. So you might get some different surveys over time too. And the surveys you get, and we were saying this earlier, it depends on how you identify yourself. And you could be identified as multiples, right? Like, I'm a person living with HD, I'm a caregiver for someone with HD, and I lost someone who had HD. You could fill out 3 different profiles and you would get notifications on each. It's really hard to mix those things up because they're like different tabs on a dashboard. So that piece, once you're in, you'll see that. We won't get into it too in depth today because we'll have someone else talk about that later. Those are the kinds of things that are really helped managed by the system. If you need help, Katie, I'm gonna guess because I just know you that you're like, if people have questions, just get in touch with me. And the same thing, get in touch with me. But if you've got specific questions about what's happening when you go onto the system or go into the system or onto the platform, the good news is that RareX provides help. They will answer technical questions. They will answer questions that might come up, like when you're in the middle of a survey and you're like, wait, what is this? You can either get in touch with them by phone or by email. And they've got someone specifically who will answer questions that people who are completing the surveys, who are signing up, who are doing the consent form might have. So by all means, Katie and I aren't, maybe you are, Katie. I am not a tech expert. I will not be able to help you with some of that stuff. But a lot of the kind of programmatic things and things specific to answering the questionnaires, you can get directly in touch with the RareX team. And then stay tuned for more because, like we've been saying, this is just the first time we're talking about this with y'all, right? There's going to be more that comes out, and we'll do it in different ways, right? It won't always just be like this long kind of lecture thing that we're doing right now. And I'm going to try to wrap that up real quick and we'll move on to the question piece. But also just to say, we're listening. And when we hear things from you all, it might be as simple as saying, oh, we'll do a 5-minute video about how to create your login, or talking about, stay tuned for the end of 2024. This kind of thing is going to be coming, right? Like, so we'll make sure that we keep sharing that info, but you'll also always get those updates through the system itself. All right. So that's how you can get help with it. Of course, you can always go back to this QR code and sign up. I've seen a couple of people who said they signed up. That's awesome. Let's get to some questions. And we're going to ask you guys to ask us questions. And some of you are already putting them in the Q&A. I don't think I mentioned that at the top too. I'm so sorry, a half an hour in. If you've got questions, you could put them in the Q&A at any time. We are watching it. We will answer it. But then we'll also, go to a point where we're like, just fire away, folks. But we started by putting some questions together that both Katie and I have been asked before, and we've heard from other people in the community. So we wanted to put those out in front of you all first because I'm thinking they're pretty common ones, right? So how are these surveys going to help research? Katie, you touched on this before. Do you want to say anything on that?
Yeah, and I think one thing I think that's really important that you said that I'm going to back up is you said you may receive like surveys that are very similar because things are changing and and you're updating. And I think that is like we've seen that with like all this news coming out with, Wave and Unicure and Generation HU2 and all these things is that our perspective is kind of changing as we're learning about these different things where we wouldn't be willing to do something before. Now we may be a little bit more willing and vice versa. So I think that knowing that these are going to come in and they may change a little bit, that's good because we are going to change our minds too as we get more information about these different drugs and therapies that will be coming out. Um,
I was just gonna say, love that point, and that's something we are constantly learning, right? Like in Huntington's disease, it was a big deal when we discovered the gene, right? And people were just like, all this stuff's gonna happen, and a ton of stuff has happened, but we're still in the learning process. And the more data we get, the more we can move things along. And so, providing, answering surveys, answering these surveys in PowerHD, answering any other survey that you've got the time to answer provides information. Please do it. Just remember, what is cool about PowerHD is it's coming from you, the individual who is completing this. This is my data. This is my info.
I think one of the big things that Arik for the how does survey going to help research? I can't even tell you how many meetings I'm in, and I'll be with someone, a new sponsor coming out or looking at HD, a new researcher, and they'll ask me to come do a presentation, and I'll do a presentation, and then they'll raise their hand and they're like, wait, that's not a part of HD, and I'm like, wait, what? you're you don't know, like, one of them has been hyper and hyposexuality, and they're like, well, that's not a part of HD, and I'm like, you're a HD researcher, like, and you're not identifying some of these very prominent symptoms that very much impact our lives. And so I think with the drug development part, a lot of these surveys are going to help them identify different things that they are actually don't know. And then on a regulatory basis, you have to remember that not HD, sorry, the FDA is they're there to protect us. And I know doesn't feel like that. I know sometimes it feels frustrating, but that is their goal, is to make sure that we're safe, it's effective, and our bodies can tolerate it, right? The three things. And so how are they going to know when looking at this? The one thing I do love about the FDA is they do ask about patient burden. They do ask about symptom burden. They do ask frustration about the lack of symptom management. What symptoms are important to us to manage? What aren't? And they're not going to really know how important these symptoms are to us and our families and our burden of our life, our daily life impacted by HD, unless we tell them. So that's kind of why I think they're maybe can help research, but you could probably expand on that.
Oh my God, no, that's perfect. And I just will repeat something we said earlier too, is like, when it comes to things like regulators, we are going to have data that we can put in front of them, because their job is to keep people safe, to make sure that things work, and to be able to say there's a reason that we're approving something because we've got data that backs it up, right? So that's where this is really important. You made a point, Katie, that I think is tying us directly into our next question, which is, why am I sometimes getting surveys that are not HD specific? Because sometimes we learn things about Huntington's disease by asking questions that aren't just about Huntington's disease. Sometimes it's through these conversations of people, or through people doing surveys where, oh my God, 100 people with Huntington's disease filled out this survey and they all checked the same thing. They all endorsed the same answer. We weren't expecting that. We just learned something. That's part of it, but it's also because HD is just a part of the person who is completing the survey. We are trying to get a big picture perspective, the whole life. There are going to be a lot of HD specific questionnaires, but it really is, we're looking at every aspect of the person because that is part of their lived experience with the disease. And that's, I think we've had these conversations over the last couple of years, right? Sometimes we learn things in science because something doesn't work. Sometimes we learn things in science because we weren't really thinking that question was important, but when everyone answers it the same way, we're going to look at it differently. So it's good to have things that aren't just HD specific.
Yeah, and I think that that's really important what you brought up, Eric, because I think this could be confusing to you when you go in and you sign up for this, and you see a survey for a PD or like Parkinson's disease, or
Yeah.
you see something for SMA or something, and you're going to be like, whoa, 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 wait a minute, I've signed up for the wrong platform, or I'm on the wrong site, or I'm on the wrong, you know what I mean? It's
Mhm.
so that you are going to see things with other disease spaces names on it, and maybe possibly other disease space terminology that is unclear to us. And if you do that, I mean, I say reach out to us, like say
Mhm.
like, look, this was really confusing for me. And I think that we're open to bringing that conversation back to Rare X. Absolutely.
I can, and you know what? I can speak to that too, because the questionnaires that people are going to see have all been selected by expert working groups, two of which have been HD specific that have just happened in the last like 6 months, where people have come together from academia, from HD clinics, from disease groups outside of HD, from from people in pharma who all know the disease, who say, this scale, while it might not be a specific HD scale, is validated in Huntington's disease, has been used in these other studies, and we know that the data coming from it speaks to what a person living with HD has. So that's a great point. You might open a questionnaire and go, why the heck does it say this? But just understand that these empirically validated scales, which again, this is like 2 or 3 slides from here. I will totally get to it. I
Sorry.
promise. No, not on you. This is just the reality of like, this is the data is important, and the data is useful because it says something that people who are doing the science, who are doing the research, can use it. Do I have to have a research partner if I participate in this? Simple answer is no, you don't. You're going to be asked if you have someone that you can identify. If you've got someone that you want to participate as that research partner, who's either a care partner, a life partner, your best friend, someone who knows you well, who can talk about your experience with Huntington's disease, that's awesome because it gives us that outsider perspective, but it's not required. It's great if you have someone, it's great if you can involve someone else in this with you, but it's not required. Anyone with HD can be in this if you've got someone that wants to participate with you and that you want to participate with you. We'd love to have them, because that's information that's not out there a whole lot, and so that will be unique to us, and really I think something that's going to be helpful, especially as we watch this data grow over time.
And Eric, thank you for saying like, oh, your best friend, because I think a lot of times care partner, caregiver, research partner, all the words we're going to use, people think of a
Yeah.
spouse, they think of a
Mm-hmm.
parent, they think of a direct family member. And
Mm-hmm.
sometimes they are your best friends. And sometimes they are those partners that walk. We know a lot of people in the HD space that their closest friends from childhood is actually their care partner and caregiver till the end of life.
Mm-hmm.
So it doesn't mean, thank you for saying that, does not mean your spouse, your
Yeah.
parent. It's who you consider your partner.
Yeah. Someone who knows you, that you think can speak about your experience, right? And that you're willing to have them do that. I think that's, thanks for calling it out, because it is so true. I think we often get kind of stuck in that trope of, oh, it's got to be the person I'm married to or dating. Doesn't have to be. You could be married or dating someone and still choose your best friend, right? Like, that is who's the
Right.
person that knows me and my experience.
Right.
Why am I receiving surveys for a care partner when I didn't sign up for it? Contact the Rare X team. I don't mean to say that I hear that's kind of glib, but really truly find out. Sometimes we accidentally check yes on a box when we don't mean to do it. Sometimes we might be getting the wires crossed in the algorithm. There's a question that came here through that said, if I'm signed up as 3 things, sometimes it gets a little confusing. And that's true. Sometimes we just need to step back and look at it and say, okay, self, did I do something? But then if we can't figure it out, that's what the help is there for. Take advantage of that help. Hey, I'm getting this survey and I don't know why. And then that team will be able to say, because you identified as this, and because you entered this on another survey, I got fed this. You got this survey got assigned to you. What if I don't want to participate anymore? You don't have to. You can always change your mind. I hope that's something that people know in any research study that they're part of. We, of course, want you to complete it because that's the only way we get information, the only way that we learn. But if you get to a point you're like, this is too much, you've got that power. You've got that choice. The consent forms are dynamic. I like that term. It just means that those consent forms, once you sign it, doesn't mean you're done. You can always go back. You can always return to it, and you can say, yeah, you know, the way I was feeling about it when I first started, I didn't really want anyone to see my data, but now that I've done it for a while, I want the world to see my data, right? Like, you can make those changes. You can make the changes the other way too. And the way that the data is shared is also a choice that you make in the consenting process. So you can always go back and change your mind. I love this question that comes up a lot, which is, what, you know, we talk about de-identified data. What does that mean? It just means that the stuff that you can be identified by, your name, your social security number, your mother's maiden name, the things that we, you know, anyone who's got a credit card, you've put your identifying information out there. Most everyone who's on Facebook or one of the other social platforms, guess what? You've done it too. But in the context of research and in the context of the PowerHD platform, once you get set up, you basically just become a number, and all of the surveys that you answer, all of that data is associated with that number. That number is going to be a male or female, 40 years old, diagnosed with Huntington's disease. So there is some identifying information, but it's not saying Arik Johnson, who lives at blank, right? Like, that information is not there. There's just enough so that it's like, okay, we know this is a male. We know I am not 40 years old, but let's just pretend. And we know that this is his situation and these are his answers. That is the information that is available to people outside of your surveys, right? The people who are actually doing the research. So none of your identifying stuff gets out there. Katie and I were just talking about this before, right? Like with the whole, what happened just a week and a half ago, right? Like, data breaches happen, and it's scary, and it's sadly just kind of a part of our times, it seems like.
Yeah.
But we want people to know that, you know, RareX does their best and works with really well reputable organizations to make sure that the data is safe and secure, and that it is as de-identified as humanly possible while still being of value to research.
Yeah, and I think that that's really important. Thank you for saying that, Arik. Because I mean, how many of us have gotten where from our medical system that our data has been breached? We're getting it more and more often. We know this is happening, right? But like Arik said, we also put a lot of stuff on Facebook and Instagram. And hey, everyone knows I am not knocking social media. It's my thing. I love it. I'm on it all day long with most of you. You know that. But you know, they have taken steps to keep this very, you know, more this data you're saying safer in this on this platform. So they've taken that step, and I actually think they utilize a cyber protection company in the back end. I forget the name.
They work with the Broad Institute at
Broad
MIT.
Institute.
And I say this with all the love in the world. It's like super nerds protecting the data. And that's a gross oversimplification. And I'm a nerd and I will own it. But I also love that people like that are in control of this, right? There's reason to trust.
Absolutely.
Who can access the survey data? Anyone who's doing research. The data on the RareX platform is available for people who are doing research. And I'm saying this and I'm smiling because we've only been talking about the HD data, right? Because that's what's important to this group. There are, I'm thinking, I'm jumping ahead. So we'll combine these two things a little bit. There's about 90 different disease groups on the RareX platform, each with their own page, right? So everyone kind of has their own thing, things that are specific there to their diseases, things that are across all of them, so that people can actually go in and not just do research on Huntington's disease, but how does HD compare to this? What do we see in this other genetic condition in the data that's been collected over time? So that data is available to researchers. It is not just, and when this is something that we talk about in the calls that Katie mentioned before, we talk about like, how do people access this? Again, it's only ever going to be that de-identified. It's always just coming down to this empirically validated outcome sets. So it's stuff that is not connecting directly to the person, but it is of value, right? And it is something that I think becomes even more valuable when we see it being able to be connected to things like Enroll, like we were talking about earlier. Does RareX sell the data? No, it does not. The data is free. The data is open source free. There's a process to get there, right? Like you have to like verify that it's good. And, sometimes people answer questions wrong, and there will actually be alerts if it's like, hey, something's really seeming kind of out of the ordinary here. They look at the data, they work with the data, but then once it's at a place that it's available, we want people to be able to see it. We want the people who are doing HD research to have access to it.
Right.
Because if it wasn't, nothing's going to come of it, right?
Exactly. But then on the flip note, Arik, it's like if I can't say, hey, Arik, everyone on this call can say, hey, global, Rare X, we want all this data. You have to be a HD, researcher. You have to vet yourself. It's not like anyone can come in and get this data anytime they want.
I mean, frankly, I would love someone to come in and be like, what did I just ask for? Because you're going to get a bunch of whole numbers, and you'd be like, I don't know what to do with this. Right. And that is kind of, I am joking about that, but it is going to be a process. Like if you are a person scientist, I am trying to research something. Do you have a good proposal? Put it together. Tell us how you're going to use the data. Show it to us. Maybe it's a great idea that no one's ever thought about before, right? Like those things are very real, but we expect this to be more utilized by the clinicians, the academics, right? The people who are doing research and who need this additional perspective, right? I am not going to be pulling the data because it's a lot, and I'm not sure what I will gladly look at it, and I will gladly listen to the people who know what to do with it talk about it. What's different about PowerHD than all the other surveys that we want you guys to do? I think the biggest one, and this is, I was joking about empirically validated data. This is really important. Why is PowerHD? Why do we want you to do PowerHD? We want it to be a big single place for people to be able to come and look at and work with data that we know is telling us what it's supposed to be telling us. Empirically validated data means that this is data that comes from surveys that were designed, put through the ringer of testing, and have proven to actually measure what they're supposed to and provide an outcome that can actually be used. We're probably going to see measures getting developed over time, right? Because we always need new measures. But what PowerHD does is use measures that are already established, already used in science, so that when we have data, someone can just come in and use it and know what they're doing with it. It's also, it's also kind of exciting because in the not too distant future, we're hoping that we can connect the data from PowerHD to Enroll HD, because when you're enrolled, you get that HD ID. If we can connect the two of them together, we can look at all of that data across the line for one person without knowing who they are, but just connect it because of that unique identifying number, right? And then something that Katie said before, and I think I want to repeat as well, is as much as I want everyone who's here now and who's listening later to sign up for PowerHD, I also want you to do all the other surveys too, as much as you can. All of that is going to help. All of that information is important. Someone said this, and I threw this up there. I love this. Data is knowledge. Knowledge is power. PowerHD is a tool that can drive change. Data is knowledge. Data is tangible knowledge. Knowledge is power, and PowerHD is going to help us make things happen. I'm not going to lie. There was a moment where Katie and I are like, oh, this will be like a 30-minute conversation. It's like, holy crap, we could talk about this like
We went
all
51 minutes.
day. I know. So we want to turn over to some of the questions. There's been some great questions that have been coming in. I'm going to take one really quick, Katie, if you want to grab one that you think. Clarify Rare X versus PowerHD. Rare X is who houses PowerHD. Rare X is the platform. Rare X is um, it's the research arm of the organization Global Genes. So PowerHD is the HD specific study on the RareX platform.
Sorry, I just finished. I just saw where we could open this up. I'm so sorry.
Okay.
I feel so bad.
Oh my God.
Oh, I think we covered a lot of these though, which is great.
Oh, how about this one? Katie, can you participate in PowerHD if you're already in another study?
Absolutely. Absolutely. And here, and this leads me into, I know that in our community it's very frustrating not being able to participate in clinical research. And I know there are so many subpopulations that are excluded from clinical research. Let's say, I mean, our JHD population, our late stage people with HD, and even people on psychiatric drugs or suicide ideation. And I know that people, when we go into a clinical trial setting and we walk through those doors, they say this, you walk in knowing that there is no benefit to you. You are in clinical research and that's it. But I do know, as a community member, as a mother of children at risk, and as a husband, a caregiver of a husband that passed, every time we walk in that door, we have hope. And that is what we do. And you can't turn that off. So I know it's frustrating, and I know that this may not feel like it's enough doing these surveys and doing these, but let me tell you, it is. And so please just know that this participation is crucial, it's critical, and know that you are making the change. And I do, I am so thankful for those brave souls that walk in and put your body on the line. But you also here are putting your heart and your time on the line to change the narrative of HD, to change to change, be the last generation to live with this disease. So your work is just as important. I know that didn't answer that question, but I wanted to get that in before we were out of time.
You 100% answered the question, and then just again underlined why this is so important, right?
Yeah.
Everything, all the research in the world can be done, but unless people who are living with Huntington's disease are participating in it, especially when it comes to getting things into clinic, getting things approved, the person with HD has to be a part of it. Right? We've seen this, like if people don't sign up for clinical trials, sometimes those clinical trials close, right? Because if we don't have enough people doing it, we're not going to get enough data to show whether something works or not. We're very hopeful, and Katie, correct me if I'm over speaking here, but we're very hopeful that anyone who's going to participate in PowerHD, especially if you're in a clinical trial, you're giving more information on top of what you're already doing in that clinical trial. And if you're not in a clinical trial, hopefully doing something like PowerHD makes it easier for you to think about maybe doing a clinical trial in the future, right?
Right.
By being a part of it, it adds to the bigger work.
Yeah. I love this. I love some of these comments coming in, like, it's hard to find PowerHD on Google. I don't see it on the right page. I've searched HD. This is like information that we need to bring back to the Global Gene team, to the RareX team, sorry. So like this input is so important. So thank you so much.
Totally.
This is definitely stuff that we can bring back. And
Katie, that stuff we talk about with the other groups too, right? Like, we'll make sure that you can find this on the HDSA page. You can put it on the Help for HD page, on the HD Reach page. Like you're gonna see more and more about PowerHD. We've got some good old postcards that were getting printed up that will be able to be handed out at clinics, whether it's a center of excellence, whether it's just an HD clinic where a doctor says, hey, I want to know what's going on. We want to make sure people have that information and can share it. And we said this before, right? Like Katie and I are having this conversation today. You're going to see a lot more from people who are part of this and not just us, right? It's going to be people like, hey, I've been doing the surveys for 6 months. Here's what it's like, right? Like that's the kind of stuff that will be rolling out in time.
Absolutely. And I love people in the US, people US only, or can people participate outside of the United States?
You are hearing from the US based HD advocacy groups right now. The RareX platform, and hence PowerHD, which lives on the RareX platform, has the capability to grow. Right now, it's only in English. So if people are English speaking, they can actually complete the surveys, right? We're kind of pushing it US first just because we're the first groups talking about it, but just know that we'll be talking about that more in the future. And we know this that the RareX team is working on translations and making sure that those studies that are already empirically validated, if they've got versions in other languages that are going to give us the same data that we get from the English language versions, they'll build those out. So I know that on their larger platform, they're already working on Spanish, French, and Portuguese. So those are things that we should be watching for in the future, right? So it's US based because of who we are and how we're working with it right now, but it's English. If you speak English and you can understand English to the degree that you catch some of the subtleties in the questionnaires, then you can participate.
Yeah. Are the surveys I love this. Are the surveys appropriate for people who exhibit symptoms later, such as in their 65 and 70s, opposed to earlier 30s and 50s? Yes. Yes. I know that this is one population that gets frustrated because they're excluded in a lot of clinical trials because of age. And so, yes, absolutely use your voice. Yes, get involved in those.
Oh my God. That's such a great question, Katie. And it is, collecting that data from people. HD looks very different from person to person. There's a lot of people that, we look at the kind of normal curve, right? Like the bell curve. A lot of people fall here, but there's people who fall here too. And so answering questionnaires like this helps us gather data on all people under that curve. That's awesome.
These are actually really good questions. Age limit, can children participate? And can you have multiple personality?
I'm hoping that means multiple profiles versus multiple personalities, but you could have multiple personalities. You can have multiple profiles if you're a caregiver, a parent, a person with HD yourself, right?
Personalities, I think it meant profiles. It was just, I think that was probably more so than
that's how I'm interpreting it.
So a T or not a T. Both are yeses, so that's good. Age limit, children can participate. You already answered that one.
I think, and Katie, I'll say this for both of us. It's like we will try to get 2 questions if we didn't answer it on this call because we're hitting our hour. This is great. And know that there's going to be additional opportunities. We want you all to participate. We want you to encourage your friends and families to participate because the more data, the better. More data equals more knowledge equals more power for making changes. And we can't do this without you all, right? Like we're here yapping about it, but you're the ones who are doing it. And we want to make sure that we support you and help you through this process as much as possible. So really, Katie, thank you for suggesting this. Thank you for, being a part of this. And Betsy, thank you for being a part of it. To the other groups that we're talking to, really appreciate the fact that we are making this an effort to say, everyone who's living with HD, please get involved because the more of you that are a part of it, the better.
Absolutely. And these questions, thank you always to our HD community for showing up. You always do. These are important questions. We will get them answered. And we'll figure out how to make sure we get these to you guys. And here's the thing: we fight to be the last generation to live with HD, like past generations have been forced to do. And how we do that is we collaborate, we come together, as a community, we come together as organizations, healthcare providers, all of us. Not one organization or person is going to do this alone. We are all going to work together to get this done for our community. And so I think that's one thing that Arik and I, when we decided to do this, to show is that we are coming together to make a difference, because our HD community is our number one priority every day and will continue to be that. So great questions, guys. Thank you so much for spending some of your afternoon and evening with Arik and I.
Look forward to seeing you in the future.
Yeah. Yeah. Thank you guys all so much.
Awesome. Katie, thank you so much.
Thank
Thanks,
you.
everyone.
Bye-bye.